Hello, welcome everyone to our first June Parent Like a Pro Summit. I'm super excited to be here to celebrate our third birthday for our community and celebrating with you with a series of amazing free virtual parenting events. This is going to be the first session. We have 4 more coming up, so make sure to check out the next section and see what's going to be the topic for our future events. And let us know, where are you joining from in the chat? How old are your little ones? We're really excited to hear more about you. This is going to be a very interactive sessions. For those of you who have joined our events in the past, we're going to have a longer Q&A session. And for those of you that are new, welcome to our chat. Oh, see, we start to see some people. Hello, everyone. Hi, Kasim, joining from Michigan. Oh, soon to be 1-year-old. You're entering in that toddler phase. Anyways, I want to introduce myself. I am Maristella Lucchini. I work at Nanit. And so I will moderate this event today. I have 3 kids, and I have 2 that are out of the woods, out of toddler age, 9 and 7, but I have 1 little one that is 2-year-old. I'm a sleep specialist. I worked for a long time in academia and I've moved to Nanit 2 years ago. And we have today a special guest with us, a colleague and friend, Monica Ordway. So I'll let her introduce herself and tell us a little bit more about her expertise and her work.
Great, thank you. And honored to be the part of the first for this series. It's a great series. And I have to say a special shout out to Michigan, because I'm originally from Traverse City, Michigan, but I live in Connecticut. I am a pediatric nurse practitioner, had practiced in primary care for 10 years and had gone back to school for my PhD to study early parenting and childhood interactions. I transitioned to studying sleep in my research in 2014 or so. And since then, I've been working on sleep, particularly developing sleep interventions for early childhood, like 12 to 24 months, working with early Head Start programs. I work at Yale University School of Nursing, where I teach in the PhD program, and child development in the master's program, where we're training pediatric and family nurse practitioners.
Fantastic. So that really sets up a great conversation. We can't wait to touch all the amazing topics we have on our to-do list for today. One thing that I want to mention before we dive in, and I see all of you starting to type in the chat, we really are covering like from Texas to Connecticut to what else do we got? Atlanta. So we're live everywhere in the US. But for all of you that are attending the event today, we're gonna have 1 lucky winner who will get the sound and light. So please stay on until the end. We're gonna communicate in the chat who will be the winner. And you're also will be entered in the grand prize for this whole Parent Like a Pro Summit June session. And that will be a coupon for $500 to spend at nanit.com. So please stay on to find out who will be the lucky person. So as I said today, we are gonna start with a 20-minute conversation where Monica and I will sort of go back and forth and touch on some of the hot topics when we're thinking about toddler years. And then we're gonna have after 20 minutes, we're gonna have a longer conversation starting from your questions. So please use the Q&A function. Let us know what are your questions. I'm gonna try to keep an eye on it while Monica and I talk to see if you have specific questions on the first topic we're gonna touch, but anything I will miss, we're definitely gonna discuss at the end. Type away and let us know anything you have on your mind. I see that we really have a big range from people that are expecting their little one soon to 16-month-old, 24-month-old. So we're gonna have tons of interesting questions. So I want to kick off with a topic that I feel like everybody who's a parent have heard this buzzwords so many times, that is thinking about routines and schedule, and how we can best optimize the organization of our life when we have a little one. And so I just wanted to have can we give a general thought on why do we hear about routine so much? Why in general that's something that we should think about? And then maybe we can dive in a little bit more about some specifics of it. What do you
Sure.
think?
I mean, it's a great question. And I think it's a really important one to start off with because routines are so important for both brain development and just, from a physiological standpoint for toddlers, but also for just household, functioning. But it's very challenging to do that these days, given our busy lives and demands. I forgot to mention that I do also have two children. They're two boys that are a rising sophomore and a rising senior in college, which is very hard to believe, but it does seem like yesterday that I was um, in the position that you're all in. But I think a little sort of analogy is helpful to understand what it might feel like for a toddler and why, even though they're going to be resisting sometimes routines or boundaries, but but they still need them and they actually secretly sort of desire them. And what it is they're learning about the world, and so you as the parents are kind of helping them to shape that. So the reason why babies and toddlers sleep so much longer than adults is because there is all this brain development happening, and not just from a cognitive standpoint, but social emotional development, emotion regulation, all of that, and those are best sort of developed in an environment that's predictable. So I think thinking about routines, what's important about routines is their predictability. And so the sort of little analogy I would give is that us as adults, if we're going through a difficult time in our lives, we might, look towards a friend to call for some advice or some comfort. And we all have, a variety of friends, some who are, just fly by night and fun to be around, but maybe not as reliable all the time. And then there's others who are, you just count on them, and maybe your more
Our
your
rocks.
more serious friends or whatever. And I think when you're going through, when you're sort of feeling dysregulated, what you're going to be likely looking towards is that friend who's more predictable. And so when children are dysregulated, it's actually, they're learning, and it's almost, think about it as sometimes a confusion. And so when we can minimize that by providing a predictable environment. And so starting with a bedtime routine is probably one of the ones that I would really highlight in this context, but I also think it's an easier one to focus on when our lives are so chaotic during the day. So something that's not a long period of time, 20 minutes, is enough, 15, 20 minutes, but have 4 or 5 things that you do in the same order every night. So maybe it's brush the teeth, bathe or whatever, put the pajamas on, read a book. And then I always like to end with some type of mantra, like, good night, I love you, I'll see you in the morning. And so that sort of becomes a symbol or signal, sorry, for nighttime and bedtime.
Right. It's time to go. Yeah, and I think you were saying, like, the bedtime is definitely sort of um, one pillar that
Hmm.
it's very important. But I think, like, you brought up the topic of them resisting,
Hmm.
which I feel like it's something we're gonna hear
Yeah.
often throughout this conversation. What are some other moments where you think like this regularity can come in handy? And I'm thinking about, for example, on the topic about feeding and resisting the feeding,
Hmm.
them becoming a little bit more picky eater,
Yeah.
being afraid they haven't eaten enough, how that might impact their sleep. Like, what are some of the suggestions that you think about when you think about this scheduling and these routines for these?
Right. Right. No, great question. I mean, I think, obviously in the first year or until they're mobile, you have a lot more sort of control over, and, it's what they're eating, and all of a sudden when they're able to be, they're moving more and they have more of a capacity for, they're learning about their environment. So they're learning where they're trying to figure out what limits can I push and where can I go. And with the feeding in particular, what I notice is that parents are used to, there's so much growth that happens in the first 12 months. And that growth trajectory, the growth velocity actually slows down tremendously during toddlerhood. And they become they're very busy and active, but their nutritional needs, in terms of, the volume, is not as much. And so because they're so busy wanting to learn and explore, they actually have to be hungry before they want to eat. So I think a common thing that happens is that, you come home from work, say, and you give a few goldfish crackers to tide them over while you're, making dinner. But those few goldfish crackers can be enough to curb their
Satisfy-
appetite. So
Yeah,
then when you go to serve dinner, they don't want to eat because they're not hungry. And I'm not saying they need to be starving, but it's, a few crackers is enough to sort of push off their hunger cues. So if you're going to give them a little snack, maybe make it some part of the meal that's already ready. If you feel like they need to have something.
yeah.
So that's one thing I notice.
Yeah, that's super interesting. And I was just reading one comment right now. One day he likes something, one
Hmm.
day he doesn't. How do we
Yeah.
make them eat veggies? And something that I've noticed is that, as you were saying, they're learning. They're
Hmm.
learning. And very often I see my 2-year-old pushing away something that the day before he ate it. And of course, it's super puzzling. It's super confusing. You spend time to make the food. It's very
Yeah.
easy to sort of feel frustrated, take it personally. Something that I've noticed that, as you're saying, it's a time where they're learning and exploring. And very often I notice that when they're pushing away food, there's something else that is more attractive. Maybe
Hmm.
there's like the older brother that is making funny faces, and all
Yeah.
of a sudden that food is not attractive anymore. And they're just like wanting to divert their attention totally
Yeah.
towards that. So I think like understanding that what they like, they don't like, they're still developing that. And
Yeah.
the fact that one day they push something away doesn't mean that we sort of should give up.
Yeah.
Um, Something that I've also noticed is that in the beginning, I think like coming from my old sort of old school upbringing, I was very afraid of when my toddlers were like touching the food and sort of playing with it. And
Hmm.
then little by little, I've really, I don't know if that's something that you have noticed too, that it's really, as you're saying, they're learning, they're discovering. Sometimes that's
Hmm.
something that they do to, try to figure out what that is, why it's a
Yeah.
different texture,
Yeah.
what's going on in the plate. I've never
Yeah.
seen that cut up that way.
Yeah.
Or I don't know, like if you have
Yeah.
any thoughts about, picky eating or things that maybe our parents can be helped to stick with their routines of feeding.
Yeah. No, I think it's definitely a common worry of all parents, and you gave some great examples. I think they're exploring the textures is a really interesting thing. Something that comes in mind that's sort of unrelated but related is it's a really great opportunity to use a lot of language and vocabulary, because the more words you use with your children, the more their language development is happening and they're recognizing words. So if they push something off, like, oh, I'm wondering why I noticed that you liked that yesterday and today you don't seem to want that, or like, and it seems silly, but more words you can use. And as far as them, sort of pushing it away, I think parents sometimes have a tendency to think, or we all do, that 1 or 2-year-old has a higher capacity for manipulation or for like intentionality. And I think sort of backing it up and understanding that they're just it's about learning. It's sort of oh, let me see what happens if I do this, let me see what happens if I do that. And one sort of trap I think I see parents kind of fall into is that, oh, you don't like that, let me try to make something else. And then they, instead of giving them whatever you're making for dinner, I've known parents who have changed it, 4 or 5 different things that they're offering. And what the message is that it's there's no sort of boundary or limit there. And I'm not saying be so rigid that you're like you're only getting this, but just keep an eye on, like, if you're noticing that you keep having to, or you're feeling like you have to keep changing things, they won't starve themselves. Like we're talking
If there's no
about
concerns, yes, like
exactly,
we're
if there's
talking
no
about a
medical
normal situation. Yes, yes,
yes,
for sure.
yes. If there are
And
no
I think that,
medical
yeah,
concerns,
that goes
they're
back.
not
Yeah,
good. Good.
sorry, that goes back to what you were saying about the bedtime routine, because I feel
Mhm.
like this idea of not keep on giving in. I mean, for me, around bedtime is also super important, right?
Mhm.
Because I think that it's normal. They want to know, oh, what happens if I touch this button? Like, how many times am I in the elevator and my son tries to push the button that would, start all the alerts and
Yeah.
everybody, and block the elevator, and it's bright, it's shiny, it's
Yeah.
the only red or yellow ones. Of course, he wants to touch that one, right? And that it's not his fault. He's 2-year-old. He's attracted to that. Or there's a new book. There's something else in the room. And something that I was thinking about when you were talking about predictability. In the beginning with my first one, I was so annoyed that every night we were reading the same book and I just
Mhm.
could not read it anymore.
Mhm.
And then I noticed that it was so exciting for her to read a different book at night.
Mhm.
She would start to flip through the pages. I mean, and then as she got older, it was a little easier. But I remember there was a specific time where that book for her was like this signal, this
Yeah.
consistency, this predictability.
Yeah.
So I think like the theme of predictability and the theme of um, making sure that you are providing a safe, but at the same time, contained,
Right.
some boundaries that they can sort of be within.
Right.
It's super interesting, and at the same time, I think like this mom is this parent is asking, they just don't love mashed potatoes. I tried everything
Right.
else, and I mean the good thing is that luckily there's a lot of other option, and I understand that as parents if we're preparing mashed potatoes for everyone else, then it's a little upsetting that they're not gonna eat it. Hopefully, I mean, the idea is that I think we try to give them, a food with 2 or 3 things that they can pick from, and if they're not gonna eat mashed potatoes today, it's as you said, they're not gonna starve. As long as overall we're trying to give like enough nutrition, we should be fine.
Yeah.
And so, and I think that goes back also sometimes to the worry of them not being full enough, and if they're gonna
Yeah.
wake up, do we need to give them more food? So,
Yeah.
what do you think about that? They can sort of self-regulate. If they're not gonna eat, they should be fine.
Yeah, I think not having to worry about that as much of like that they're going to wait. They nutritionally they don't need something overnight, and they have enough reserves that after like one night of not eating, they're not going to, wake up. And what you'll find is that you might have 2 good days of eating and then a bad day, and then 2 bad days and 3 good days. And so it can be, sort of erratic. And I think, there was a question about is it rather better to give something than nothing. And I think I would say nutritionally healthy. Like I would avoid sort of going for those easier processed foods. So as much as you can to give something that's of nutritional value. And if it's important to you, I mean, different people have different philosophies around feeding. So, if your philosophy is about, grazing, then that's fine as long as it's sort of a healthy content. If
Yeah.
you're trying to get to more of a routine, then I would suggest that you focus on those whatever meal schedule that you would like. And when we're saying about learning, it's not just about them. I think Marissa, like we know that it's how we react to them, like that is where the learning comes from, right? So it's partly like the texture and that, but it's also let me see what my parent does when I push the food away or when I try to push the button. And so using techniques like distraction or ignoring it or sort of not engaging it if it's behavior you don't want, not necessarily saying no, but either ignoring it, not giving it attention, or distraction can be.
Yeah, I think that that's super interesting. And one tips that I also learned from my own experience, my son goes to daycare. And I know more or less what they eat, but I have other 2 kids. I'm always like
Yeah,
picking them up and rushing to do other stuff. But lately I've started to ask like how was his last meal? Or how did he eat during the day?
yeah,
Because there's many days when they're like, oh my God, he ate so much. He really liked those rice and beans
yeah,
and then and I'm like, okay, that I'm sort of set up and prepared to know that probably that night he's not gonna eat a lot. It's gonna be fine. It just also gives me a little bit of a peace of mind. And so I think just sort of for those parents that are not with their child throughout the whole day, um, figuring out what happened the rest of the day can also help. And
yeah,
see maybe, at daycare they're eating all those other things. So it's fine. My son also sometimes at night he's so tired that he's so there's like sort of seeing the bigger picture
yeah.
and I think like because I this thing of daycare just came up, I just wanted to sort of go back a little bit about this idea of routines,
Hmm.
because I feel like very often when we have to work with sort of outside schedules, that
Hmm.
might be tricky, right?
Hmm.
So what are some suggestions? And I don't know parents, feel free to chime in here and let us know what is your current setup in terms of childcare. Are they at home? Are they at a daycare? Are they with a nanny? Are they with a relative? Are you home with them? How can we make it work when we have to sort of comply with schedules that are set up outside of our own control?
Yeah. You know, I am just a big believer. And Maricela, you and I have talked about this a lot. That you know, I think it always has to be. We need to first hear from the parent about what is either a necessity for them or a choice. And so, because when I see patients in the sleep clinic, for example, and I give advice, I always say, do you feel like is this going to work for your family? Because if not, I want you to imagine I have like a bag of other tricks here, and there's not just one solution to everyone's problem. There's a lot of context that goes into this. And I think daycare is one where I recently had a conversation with a woman who was very, very judgmental about putting children in daycare. And, I'm in a totally different frame of mind with that. And I think that what you just have to think about is what is the schedule and how can you work towards managing that? Because you're not going to change sort of the agency's, routine that they have for the other, 7 children in the infant room or toddler room. And it's really a great example of routine, though. Like I remember going to pick up my son at daycare and for a doctor's appointment or something, and it was during nap time. And so the lights were off, and usually and you should ask them, are they required to stay on the cot? Could they, can they get up? That kind of thing, I would say. But I think so. I remember going in there, and he was sitting on his cot, and he saw me, and he knew I was coming to pick him up. He would not get off that cot until the teacher had told him, he could. And I didn't see it as, that's what he knew was routine. Like when the lights go off, they know they go on the cot. And then when the lights come back on, they know they can get off the cot. And if we could all have that level of routine in our home, like
Great.
wow, but that's not going to happen. That only happens when you're in like that mass,
Yeah.
And I think when it's conflicting, I think general rules or with napping when they start to get, toddlerhood, I would really recommend that the naps end before 3 or 3:30 p.m. We find that if they are napping after 3:30, that it delays their bedtime at night. So I would encourage that. But short of that, I think there can be some flexibility. Because we
Yeah.
all can't do things exactly the same. And you have grandma
Yeah.
over, and grandma has her own, ideas about things. And
Yeah, that makes sense. And I think like for me, I remember touring daycares and with my first daughter, and I remember them telling me everything about their organic food, how often they would go outside, and nobody told me what was their sleep schedules. And I
Mhm.
was like, can you tell me what is your schedule? And I started to inquire, and I have to say that one of the things that for me was important to figure out a daycare that sort of had a schedule that would work for us. Some
Mhm.
daycares do nap time later, some daycares do it earlier, some daycares have different setups where they go to bed. So definitely this is something that I think it's a good it's important to have a good conversation with your daycare providers if
Mhm.
that's what works for you, or with your nanny, share and discuss what is your
Mhm.
philosophy about scheduling, and have and set up the right expectations when you're looking for someone and when you're working for someone. And I was just reading this comment about this family that does homeschool. Everybody's at home, and in the summer there's a lot of shifting around. And I just wanted to share, and seeing how that sort of it's necessary, but also could mess up things sometime. And something that I've noticed with my family, again, we have 3 kids. We live in New York. We live in New York. We also love New York. We live in New York. We don't have a lot of homestead projects. I would love for us to have that, but we live in a tiny apartment. But the summer still has a huge impact on our schedules. We have this beautiful park in front of us, and there are days where I consciously make a decision to say, we're just gonna come home later because there's
Mhm.
these beautiful things that we can do, or we're gonna do dinner at the park, we're gonna have a picnic. And I know that that will mess up our schedule a bit, but I think my philosophy in terms of routines, and I want to hear your opinion, Monica,
Mhm.
is that routines serves us. Like we're not slave of our own routines.
Right.
Routines are there for us as families to function at our best and to
Mhm.
help our toddlers and our kids in general and us as parents get the best sleep, get the rest that we need. But
Mhm.
but we're not sort of slaves of our routines, and we have to make sure that we keep that in mind because there's going to be moments where other things will take a priority.
Right.
I remember also when finally in this year it snowed again in New York. Last year it didn't snow at all, and for 3 days our schedules were a mess because
Mhm.
kids saw the snow and that was it.
Yeah. Yeah.
And honestly, they were 3 precious, beautiful days. I wouldn't have changed a thing in the world. And the other thing is that when you usually have schedules, I feel like it's easier to bounce back. Like that,
Mhm.
those couple of days where things are a little erratic,
Yeah.
it's easier to just go back. I don't
Yeah.
know. That's my feeling.
I
What would
think that's exactly what I was thinking. I think that's perfect, is that if you are generally, someone who's routine and then you have, an interruption, I mean, we all need vacations. It's nice to go visit people. Like I don't think you should be, restricted just to your home or so strict about the routines at all. I think it's more about, it's a general approach. So something that I would think about is, when you were talking about the same book every night, but the other thing that I find can happen is that I want one more book, one more book, one more book, and I really would encourage parents to say, I say reading is great, and then they tell themselves, oh well, it's great if I'm reading 5 books, and it is, but I would encourage you to read, four, 3 or 4 of those other books during the day so that it stays to always it's 1 or 2 books at night. And so that stays, like, that little subtlety can make a big difference. It's just that, giving the new food every time kind of sends this message. It's more because they're seeing their reaction is that if I do this, what's sort of the limiting factor, and you know again, it has to fit for you all. But I love what you said. Like, it's absolutely, I hope nobody would leave this thinking like they have to be rigid about their routine,
Yeah.
because otherwise we're stifling creativity too, right? And with socialization, there's so many other factors.
Yeah, no, I agree. I think that's a great point. I also think, in general, whenever we start to feel like super guilty, then like, that alters the relationship that we're able to have with our kids. Like I think like we need to remember that we are the best parents for our kids. We try to make the best decisions. And
Yeah,
sometimes we try something and it might
yeah,
not work. And that's
yeah,
fine. And we're not
yeah.
gonna do it the next day.
Yeah, in
And
child
I
development, there's a famous child development expert, and what we recommend, or what we say, is that you need to be a good enough parent 30% of the time. And that's not to say that 70% of the time you're a bad parent. It's that there, it's um, who would want, like, the idea of a child growing up in a household where they did everything perfect is setting a child up for failure in my mind too, because life isn't perfect and things are going to interrupt. And so allowing your children to see you mess up, and um, sort of either, if it's messed up directly with the child, to apologize. That's something I worked really hard with my own boys on, is because I grew up in a military Catholic household where things were, very much right or wrong, and parents, it's because my way and, the highway. And so when I messed up, I would say, you know what, I was thinking about it and I wish I had handled that differently. And I don't think they're too young to at any point to kind of give that message. And of course, I'm in this privileged spot of having now
the
adult
benefit of
children. And
it.
I will tell you, though, since they're recently adults, I knew I knew that I was worrying more than I needed to, right? I was like, there was a part of me that knew someday, I would say to myself, someday I'm going to regret that I spent all this time worrying. But
Yes.
it's hard not to. But now I look back at it, and people say to me a lot this past year, because we were newly empty nesters, how is it being empty nesters? I'm like, that they're good. It's like, it's so easy, but it's not to say that what I went through was easy. I just, sometimes I wish I had a crystal ball for all of you. I think that if we can help parents not feel the guilt that sort of is implied to us by either social media or our friends, or, the comparisons are the biggest thing. But just remember, 30% doing it right is you're passing good.
Yeah. Yeah, and I think like, with toddlers, there's also such a huge range. Like, I think it's really hard to compare what different people do at different time. They hit milestones at very different
Yeah.
time. And so that's so important. And thinking about, milestones and big changes that
Mhm.
happen into toddlerhood, I was thinking about one big thing that Mary parents wonder when it's the right time to do, which is transitioning to a bed.
Mhm.
And I think that that's very important because thinking about what is the right timing and not
Yeah.
having anyone else sort of, oh, because they have done it, I should do it. But
Yeah.
also it ties very well about what we're saying about boundaries and setting boundaries, because
Mhm.
when we're moving to bed, we're literally like getting rid of some physical boundaries.
Yeah.
That's probably when it's a time where we need to step up our own boundary game. Let's put it
Yeah.
this way. So, do you have any recommendation or any suggestions around that?
Sure. I mean, we generally recommend in pediatrics that, when we're working in primary care, that three, and even in the sleep clinic, that by three they should probably transition to a bed, or if it's not safe, like if they're climbing out now. If you could lower the crib, just from a safety perspective, but there's no developmental reason to do it before, three. And I think there's probably more of a developmental reason to keep that boundary, because they're at three is when they start to understand. Well, we would shift our sleep training ideas from to things that are more reward based, and around three they can start to understand that a little bit at a whole another level of consequences, so kind of keeping them in the bed. I think if you transition them earlier, sometimes it works great, but if you don't have to, or you don't feel like it's a safety issue, I would try to work towards three.
And we're getting a comment of like, oh, it's scary to think about it. I hope it will not affect, my kids' sleep. And what I've seen is that there's a lot of changes. Like, what your baby could be sleeping great, and then all of a sudden into toddlerhood, he discovers something new and it's getting harder. But establishing you know, good sleep hygiene from the beginning, establishing a schedules is a long-term investment. This is
Hmm.
what I've noticed that in general, things can shift, things can have ups and downs,
Hmm.
but I always encourage parents to start as early as possible because that sort of lays good foundation in
Yeah.
terms of how sleep is perceived. And the other thing that I want to say is that, I've going back to my tiny apartment, we've had to change to move, for example, my toddler from the crib to the bed earlier than I would want to.
Hmm.
And, I mean, he was 2.5. He was not like a tiny baby, but still, it was a little bit earlier that I wouldn't want to, but we just couldn't fit all the beds in the room. It's
Yeah.
New York life. Uh,
Logistics, exactly.
and I think like that goes to the fact that, as you're saying, we always have to think about the right thing is what works, and sometimes
Hmm.
you kind of have to do a little bit of a puzzle of all
Yeah.
this information that you have.
Yeah.
There's not one thing that works. You have to figure out what works for you, depending on if you have other kids, if like, or if
Hmm.
spaces that you have. And I think that that's so important, again, to sort of tame down that continuous worrying and guilt sense that
Yeah.
we could get.
Yeah.
And I wanted to, hear also from the parents that are connected, because I'm going to start a new fun topic that it's about toddler regressions. And
Hmm.
so, uh, are they real? How would you recommend navigate them or troubleshoot them or figuring out if this is a real regression, like, or
Hmm.
if it's something else? How can we, rule out what are other things that could be happening at the same time? Um, we have someone saying speech regression. I'm thinking about sleep regression, but let us know if you have other questions on other topics. And so what would be your first reaction to this toddler sleep regression hot
Yeah.
topic?
Yeah. Just because you mentioned it popped up, I would say that anything not sleep related regression wise from a developmental standpoint, I would say to run that by your primary care provider. I think there are some regressions that can happen, like where they might start talking a little bit less as they're mastering another. Often when they're mastering one milestone, they can
Sort
have
of
some.
focusing. Yeah.
Right. And there can be some little bit of regression. But I think things like that, especially during this toddler period where we are starting to identify whether there are developmental delays. So that kind of regression, if you're noticing it, particularly if other people are noticing it, then I would say that's something definitely to run by, your primary care provider. But as far as the sleep regressions, I think that they're real, but I think it most likely goes back to sort of stepping back and seeing it as a bit of they're experimenting with sort of their learning process, and to sort of lean into it a little bit, but with also keeping you can, like I said, my son was sitting up in the crib, I mean, on the cot. He wasn't sleeping, so he's allowed to be awake and do some quiet activity while he's on the cot. He didn't, not forcing him to sleep. But if you can kind of keep the routine, if it's early for them to get rid of a nap, maybe thinking about, you don't have to sleep, but it's a period of rest, like it just to rest your body, rest your mind type of thing. I don't know what you hear from your clients about what
Yeah. And I think, one thing that I noticed, for example, with my son was when he started to talk more, we had like a big jump in talking, and he
mhm,
would wake up in the middle of the night. And before I wouldn't even notice, like he would
yeah,
probably wake up, roll around, fall asleep again. And then because he was learning all those words, he would wake up and start to say all those words.
mhm,
And so all of a sudden, I was much more aware of all his nighttime awakenings. And most of the time, he did not need anything from me. It was
mhm,
mostly just him practicing, and it can happen sometimes similarly when they're learning some motor milestones that they're trying to get under for, like all these things. So I think that, as you're saying, it's just interesting to be aware of what is going on in the rest of their life. And then I think,
Maristella, can I just pick up on something you said about the that they were probably waking up before and you didn't notice. I think
Mhm.
of something that I find in sleep clinic that's really helpful for parents is to make them aware of how normal it is that we all, including adults, we all wake up. We probably wake up 4 or 5 times a night in these micro arousals, and younger children even more so, maybe even 5 to 8. And we call them micro arousals, and there's 4 stages of sleep, and every time we cycle through a new stage, we have a little micro arousal. As you know, Marissa, I'm like talking to you like you don't know these things. But I think parents, it can be very empowering to know that they will fall back asleep if they're in the environment that they normally were. So if they fell asleep with parental presence, when they wake up, they're going to expect parental presence to be there to fall back asleep. So it's like when we have these micro arousals in our own home, we don't recognize them because we're in our bed, and so we in our own home. But if we were in a hotel or we fell asleep on the couch, we our micro arousal becomes a more alert arousal, and we might have a little conversation with ourselves and tell ourselves to, okay, I'm on the couch. Do I want to go to bed? Do I just stay on the couch? Or I'm in a hotel. And you might start thinking about your day and then you're up. But if you're it's about the familiarity. So if they're waking up and they're practicing, like you said, that's a time where those micro arousals may become a little bit longer in length because they're practicing their milestones. But that doesn't mean exactly what you said. Doesn't mean you have to go and attend to them because they're, awake. That's a normal sort of
Yeah.
process for them.
Yeah. And you know what, I was thinking about something that we said before, because we talked about and I'm sort of jumping a little back and forth between the topics that we touched, but thinking about toddler sleep, moving them maybe out of the crib, regressions maybe with like early wake ups. I don't know, that's something that has happened with all my
Mm,
kids. They try to they all of a sudden they were waking up at 6:30, and all of a sudden it's sort of
yeah,
bounced back with like 1 hour of what's going on.
yeah.
And like I know, like with my kids, we have introduced, the clock with the light, and trying
Mm,
to, because as you
yeah,
establish boundaries when you put them to bed,
yeah.
that could also be something that we think about for the morning when they wake up. Do you
Yeah.
have some thoughts?
Yeah, no, I think like what you're talking about, those like alarms, like it's like a green light. Okay, it's okay to wake up. It's
Exactly.
okay
Yes.
to get out of bed.
Yes.
So I think that's something again around that 3-year-old age
Yeah.
group is when they can start to understand that because it's part of that reward system.
Yes. Yeah.
Um, and so I think that's a great tip, is sort of giving some guidance around that. The other thing to emphasize is that, when we're sleeping, that's when we are all, and children particularly, are processing what we've learned during the day. So it's a very active state when you're asleep, and it happens during slow wave sleep and REM sleep. And the REM sleep is more concentrated later in the night. So I wonder, I don't know if there's been any like sort of biology or physiology studies on sleep regressions, but it, may have to do with having more REM sleep, more dream state sleep, and then waking up and having a little bit more awakeness, alertness in the morning for toddlers. And then they're anxious to kind of explore and see the world. But that's why they, it's not uncommon to see them practice it because they are they're sort of strengthening the synapses, the connections in their brain during sleep, and they're also pruning them. They're getting rid of things that they don't
Not
need because they have
helpful.
more than we all are born with way more than
Yeah.
we can use. So yeah, a lot going on at night.
That's a good question. So I was keeping an eye on the chat, the Q&A, and
Yeah.
what I wanted to touch one point because I think like, this is an age where we start to drop naps and some kids
Hmm.
start a little earlier than others. And so some parents were asking, are my kids getting enough sleep? And I think
Hmm.
like thinking about the 20, so there are some reference times for when the kids should drop their nap. But again, every kid is a little different. So there's
Yeah.
going to be some, gray areas. But also thinking about the 24-hour period.
Hmm.
You have some recommendation around that to sort of have a sense of parents to keep an eye. Are they getting enough sleep? Maybe they drop their nap, but
Yeah.
they're sleeping more at night or whatnot. Yeah.
Mhm. Yeah. No, I think so. If you can get to like an 11 to 14 hours in a 24-hour period, in the toddlerhood, 11 or 12, I might have to go back. But and it's also a range, right? So be prepared that I find too infancy and you might have your sister-in-law had their baby, your nephew sleeps still within that recommended 3 or 4 hour window of recommended time. But a baby or a toddler sleeping 3 hours more than your child is can make you feel like your child isn't doing enough, right? Or sleeping enough. And there is truth to, my boys continued to nap into kindergarten. Like they were sleepers, and
I
my
needed
younger
that.
one
Yeah.
still is a sleeper. And yeah, so I think he also gets hangry. So it's like, he's much more sensitive to those sort of physiologic changes. Um, I hope, hopefully I kind of addressed that.
And I think that one thing that it's interesting to me is that even within my own three kids, I see different needs. And I think that usually when we see also their behavior during the day and how they're doing, we can tell if what they're getting is enough.
Yeah.
And that really helps us, because
Oh yeah.
maybe my daughter always wakes up like a little earlier than my son. She's just an early riser. I am the same.
Yeah.
But I can see that throughout the day she's doing well. She can attend to school. She can be attentive. She's in a good mood. So I'm not concerned. If
Right.
I were picking up some signals that, she was always waking up cranky, that she would, then I think we have to observe our children. There are
Yes,
some
exactly right.
recommended
Hmm.
guidelines, but we as parents can pick up signals of like they're not getting enough.
Yeah.
And we actually have a question on the opposite direction, like how long is too long to let them sleep? Because
Hmm.
I say sometimes my kid will sleep 12, 15 hours and one nap. Some other days he will sleep 10 hours and then they will nap. And
Hmm.
to me, I mean, I don't know exactly. I've lost track of maybe how old is the child. I feel like that's sometimes the behavior when we are a little bit in between schedules of maybe
Yeah.
dropping the nap and keeping the nap. But also I feel like it depends a lot also what they do during the day.
Yeah.
And remember, like if you're already in that window of time where they're about to but they're not fully ready, 20
Yeah.
months old, so
Yeah.
probably a little bit early to fully drop the nap. But I feel like I don't know what would be your comment on that.
Yeah, I think it's two things. I think first of all, I think what you're describing in terms of that longer, some nights are long. Same as I was saying with eating. It's normal to have those 2 to good days. But something that I in my research I really and I think a lot of us are moving towards, the concept of sleep health and sleep as a pillar of health is surprisingly relatively new. So the first public, I think we were excited when we saw then 2021, the definition of sleep health in pediatrics was published. That's kind of ridiculous when you think about it, just 3 years ago. But one of the things that is so important about the way we're defining sleep health now is that it's not just about duration. It's about the behaviors around sleep. It's satisfaction with sleep, alertness or sleepiness, the timing of sleep, the efficiency of sleep, and then lastly duration. And I'm not saying that they're in any order, but that's how the acronym be stated goes. And I think that I worry sometimes, or I'll have in clinics parents who tell me that, and this is more with like an older child, but it applies younger too, that just because you're sleeping for a long period of bed, what's sleeping versus time in bed? So you could be in bed for a long period of time, but have poor sleep efficiency or poor sleep quality, meaning that there's a lot of night wakings, longer periods of awake. And so I'm a believer in that it's we should probably, I would put it, this analogy is what I say. It's like talking about your diet and only talking about the fat content without talking about the calories and without talking about the carbohydrates and the protein, right? So it's kind of to have a good nutritional, sort of over
Balance,
some,
yeah.
in the same thing with sleep. And you touched on like the earlier, in the sleep intervention that I developed, one of the parents said to me, actually, two parents ended up saying this, that they were trying to convince their spouse that putting their child to bed earlier would allow them to sleep late. They think that, they're going to wake up even earlier. And the evidence suggests that if the earlier bedtime, later wake, or maybe I should say it the other way around. The later the bedtime, sometimes the earlier the wake up. And in both cases, it worked out that way. In their evaluation of the intervention after the study was done, it was like, my
Mind
husband,
blowing.
started, yeah, exactly, and one of them said to me, I've been telling him this forever, but now that I'm going to enroll in this study, like I think now I can tell him you're saying that I have to do this,
I will
and it,
blame you.
yeah, and it worked out.
That's so interesting. Yeah, and I love that you brought up this idea of sleep health thinking really in a very holistic, comprehensive way. And I think that again, like it's so easy to be focused on numbers, and it goes with eating, it goes with, milestones. I need to reach these milestones by this month and that month. And I think that very often the conversation is so much more rich. And I think that when we when we look at things this way, we can notice things that we had never noticed.
Right.
So I think yeah, I think it's such an interesting point of view. I wanted to jump a little bit to another topic, which is potty training.
Mm-hmm.
And so, this is the age when this happens. I just potty trained my son a couple of months ago, so it's very fresh to me.
Yep.
One of the things, so first, like some parents are asking what is the age that is recommended for potty training, and sort of what are the cues to pick up to see if your
Mm-hmm.
child's ready. And one other thing is how does it impact sleep? So I will
Mm-hmm.
just share a couple of things that happened to me and what has happened
Yep.
to me throughout the three experiences, three journeys that I had.
Yep.
I have to say that I always tried to make sure that there was some interest from the child, that I could see that with my last one, he's the third child. He had seen, the other two siblings go into the bathroom. He always wanted to be there. He always wanted to try to, like, he was really manifesting, even if it was very early on. He was 20 months old. He was not potty trained at 20 months old, but we started to bring in some tools, the potty and the books and everything, because he was just showing such interest early on.
Yep.
So I think always sort of more than just the recommended age, merge that with like your child.
Yep.
Look at your child and their sign of readiness. Or also, like, do you see that your child is able to hold their their pee for a little while? Do you notice sometimes that the diaper is dry for a long time and then they have to go to the bathroom? All these things. And then so that's thinking about picking up cues. And the other question is about how it impacts sleep. Going back to the boundaries, I noticed that my son, that when we started to potty train could, in a way, it was becoming part of our sleep routine, going to
Mhm.
the bathroom.
Yeah.
The other thing, sometimes he would tell me pee 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 pee, and I didn't know if it was real or not, and it was
Yeah.
always around bedtime. So I sort of had to make sure that I would I would communicate with him clearly what were the expectation with this new novel thing, because in the
Yeah.
beginning it's a very novel and exciting thing that they're doing around the time of bedtime. So these
Mm.
were my 2 cents, but I want to hear from you what you think of this
No,
topic.
I think that captures it wonderfully. That, picking up on the cues, noticing when the diaper might be dry longer. I think from just the age I would recommend is 18 months is typically when we would say we would start to introduce that. There's huge variations culturally, like uh, so given that. But in sort of Western world, that's what we would probably generally say 18 months. In terms of nighttime staying dry through the night, we don't actually expect that until age 6. So it can
Sure.
be normal to be wet until to use a pull up or a diaper until age 6. And so that can have a wide, that can be definitely a wide range. And then, the other piece I think that can help are things that you do to encourage it. For example, when you're changing the diaper and asking them when they're old, when they're a toddler and they can walk, like, can you go throw this away? Or can you go, it's time for a diaper change. Can you go get mommy a diaper or daddy a diaper or whatever? And then that helps, I think, giving them some responsibility for it can is both important from a learning perspective, but it also can serve as a little bit of an encouragement to it's just easier for me to go in the bathroom and use the bathroom. And the last little sort of anecdote I'll say about my oldest is a boy. For those of you parenting boys, 2 things, because I did not know this. So when I came downstairs with the younger one and found my older one who had gone to the bathroom, trying to wipe down all the toilet seat and like underneath the toilet stool. And he said he was standing there peeing and then he had to poop and he didn't know that.
What
So
to do?
it's like, oh, I didn't really think about that as a female. Like, and so that was something. And then the other thing they did was is they try to be like dad and if there's a father involved that they're seeing him go to the bathroom through a lot of times men will have the hole in their
Yeah.
opening in their underwear, and so he wanted to be like them, and so they would try to, there's no hole, somebody needs to make holes in children's underwear because they would try to put the penis up over so then the shirt was getting wet, so pee all over the shirt, and so the
Let's
babysitter
guide
said
them and
next time.
give them tips and tricks so that
Yeah,
we don't
exactly.
get surprises.
Yeah, it wasn't a good conversation when I told my husband he needed to show him how to pull his pants down to go to the bathroom. And he said, I can't do that. And he's like, imagine I'm in a restaurant and I'm standing at the urinal with my pants down around my ankles. I was
We
like,
have
okay,
different needs. We have different needs, and so
different needs.
there you
Yeah.
go.
So some
But
little
yeah,
funny things for parenting boys.
yeah. Parenting boys, always full of surprises. So this is great. So as I told you, as we are almost running at the end of the hour, and I told you right before we start, it seems like an hour is a long time, but it goes by so quickly.
Yes.
I hope I was able to, we were able to look at most of your comments and questions. There was one thing that I think we didn't address, and I just wanted to go back, which was what was your opinion on supplements when they're not eating veggies, and any favorite food that could contain veggies and could be kid friendly?
Mm,
Is there just we're switching gears, going from potty training
yeah.
to, but anyways, this was one question that I couldn't address, so I just wanted to make sure we would get to it. So, any
Yeah, no,
tips?
I think just a quick answer to that is that I would hesitate to give any sort of medical advice around supplements or additives, like without talking to your primary care provider. But as far as like hiding vegetables, I mean, the common tricks of putting it into spaghetti sauce and blending it, like used to make little like egg bites or things that, you can kind of bake and have things inside of it. So hiding things in that way. And then making them into fun shapes. I think those are sort of the,
Yeah.
um,
And
basics.
yeah, I always try to make a mix of make sure that they eat them, mixing it, and but
Mhm.
keep making sure that they see them
Yeah,
so that they know that they're part, like, because they feel like if you just hide them, they kind
yeah,
of never see them and they
yeah,
kind of never get used to it, right? So I think that sort of finding the right balance between um, making sure that they are exposed to it and
yeah,
then both visually, but also just eat them. And then
yeah.
also, very often for some kids, fruit comes a little easier.
Mm,
So that sometimes can help because they get a lot of the vitamins from that
mhm,
too. Try to make it always vary in terms of fun shapes. I love the idea of like cutting in different shapes. I also got some cute forks and stuff. Kids love
mhm.
those things.
Yeah.
So that always help. And so I think we are. Let me just take a peek at the clock. Probably. Oh wait, I wanted to read at the on the chat. Yeah, someone says like do not force them to potty train. I
Yeah.
think sorry, we're just jumping back to the potty training thing.
That's one thing that has to
So
be very
important.
positive
Yes.
reinforcement. Like,
Yes.
let them earn that M&M, put the Cheerios in the potty and let them aim for them, like
Make
all
it
yeah.
fun. Yes. Make it fun and make sure that again, this is one time where it's really, really, really important to just look at your child, see when they're ready. Try to introduce it slowly. I love bringing in books, see them.
Mhm.
Look at books, make it fun. We got some fun underwear. There really needs to be a positive environment around it because it's a big change,
Yeah.
and we want to make sure that we make it fun for them.
And the consequence, just to add from a medical perspective, the consequence of when it is so rigid and enforced is that we see a lot of withholding of stool, which
Yeah,
can be a normal thing too. Because the other thing, it's not that maybe you were being like you're punishing, but um, some children actually fear when they see it flushed down, they think it's part of them that flushed
goes
over.
away.
So it can, so that's easing into the whole flushing thing is something that some kids need to do as well. Otherwise, it's frightening and they don't want to go in the toilet.
We're probably gonna need another whole session on potty training because it's such a broad topic. But so we are at the end of at the end of our session. Monica, thank you so much. This was
Sure.
fun, and I'm glad that I'm seeing comments saying that people were, had gathered a lot of information that would be useful. We put in the chat who is our winner, which is Samantha Benoit. I hope I said your last name correctly, but lucky you for the sound and light. And remember to see the next events and RSVP if you want to join. And I hope to see you soon at our next event. Thank you so much for joining us today. Have a great rest of the day.
Bye, everyone.
Bye.
Bye bye.